Alright, while analyzing this video, we noticed our subject's knees collapse slightly inward. This could be due to an anterior pelvic tilt. An anterior pelvic tilt leads to an internal rotation of the femur, which in turn relates to her knee collapsing inwards, also referred to as genu valgum.
During the analysis of this video, we noticed the subject's knees pointing outwards as she was landing. This could be due to a posterior pelvic tilt causing the femur to externally rotate, which relates to her knees pointing outward. A posterior pelvic tilt means the subject probably has more muscular quad development with weaker hamstrings and adductor muscles.
When comparing the two videos, the subject with valgus knees has a greater Q angle, putting greater stress on the knees, which will increase the risk of an ACL injury. The subject with varus knees has a smaller Q angle due to a possibility of a posterior pelvic tilt. The greater the Q angle, the greater the risk you have of injuring your ACL.
In Lab 2, we compared two separate individuals performing two different screening tests, the crossover hop and the single leg squat. We analyzed their form and determined their strength and muscle deficits.
During the analysis of this video, we noticed the subject showed muscle weakness and an imbalance. The subject's muscle weakness in her quads, glutes, and calves are not being absorbed well, and the force is instead being transmitted to her joints that these muscles were meant to protect. The imbalance is causing an increase in the risk of an ACL injury.
During the analysis of this video, we noticed the subject showed instability and muscle weakness. The subject's weak glute muscles, her lack of ankle and knee mobility, and her improper form all contribute to an increase in risk of ACL injury.
For Lab 3, we ran through a complete ACL prevention program. We analyzed two different exercises, lunges and forward and backward single leg jumps. We used these videos to analyze the individual's muscle strength and joint stability by identifying improper technique and strength deficits.
In the analysis of this video, the subject shows proper form, showing no signs of strength imbalances or inflexibility. A lunge is a common weight-bearing exercise that simultaneously trains the muscles crossing the hip, knee, and ankle joint for strength and endurance. This ACL prevention programs tend to incorporate lunges to improve the strength of the muscles surrounding the knee and strengthen the core in order to maintain balance and posture.
We analyzed the subject's form and technique during the forward and backward single leg jumps. The subject's form is proper throughout the exercise, but if her form was improper, the impact force on her knee would be high.
To conclude all three labs done throughout this project, we can say that it is important that an individual trains themselves to land softly. Recurrent hard landings may lead to premature wear and tear of the ankle, knee, and hip joints. These frequent abrupt movements of the lower extremities transfer force up the kinetic chain higher than the body would typically experience during activities. The softer you land, without noise and slowly decelerating the weight of the body, lowers the impact forces and decreases the risk of an ACL injury.